Yeah, there are many conditions out there that, in running the Patient Alliance for Cannabis Therapeutics, the official patient alliance for Texas NORML, I have met so many people, so many individuals and that includes a lot of parents and a lot of patients who are all suffering from a numerous amount of different conditions that span across the board. And it's amazing to go to these meetings and to see such a huge demographic from age, different race. We all have something in common. We are all dealing with illness and the act of suffering, and so we all know what the act of suffering can invoke in our thoughts, invoke in our emotions. We all know what anxieties can be invoked by that as well, because coping with disability is more than just a disability itself. We definitely have to deal with the discriminations of man, the discriminations of society, and PACT opened up a window to just meet such a diverse array of people with a diverse array of different conditions. You know, it's one of those things that certain conditions are not getting the treatment they deserve because of being omitted on the list of medical conditions that can be benefited by cannabis. And I believe that it's medicine across the board, and there should be no restriction on condition. It's a matter of choice, it's an issue of choice, and the freedom of that choice.
So, with PACT, what do you hope to achieve with this organization?
In achieving this, I'll get to the basis and the fact of how it started was the fact that being a part of NORML, Texas NORML, we were having our functions and our events, and I was meeting with patients, that was happening, but it was sporadic. I wasn't getting to meet. That was either 2 at a time, 3 at a time, 1 at a time, but it was never together to where we could communicate together. And PACT was an inspiration out of that, and also the fact of my first 2 years into the movement. I joined in 2011, and over the course of 2.5 years, it was my executive director, Josh Schimberg, and myself that he inspired, that he motivated. And together, him and I, through him and I was able to find my voice because of the right assistance, having the right discipline, and each presentation just became better and better. And one day, I had felt this feeling of empowerment, not understanding what I was feeling, and I was like, "Wow!" All of a sudden, you're just ready to go now, man. You're empowered, and I was just like, "Wow! What a thing to be able to pass on to fellow patients, especially those in the cannabis closet, who to step out of that shell and to not have fear, and to move forward in addressing, the proper etiquette, manner, and discipline when it comes to talking with our representatives to make change in Texas." And so PACT was basically based out of that empowerment and that discipline. And I wanted it to be something classy and respectable. And we have to be classy and respectable in facing our opposition. That's what it takes.
Well, tell us a little bit about these meetings. What all goes on at these meetings?
At these meetings, well, first and foremost, we typically commonly put on a disclaimer that even though it isn't a legal status right now, with cannabis being legal still in the state of Texas, it's still the fact that we do not condone the production, distribution, or basically the production, distribution of hash oils, concentrates. That's not what PACT is about. PACT is a legislative group garnered towards legislation and legislation only. This way we can watch over the bills that unfold in legislature and to make sure that all is in compliance once anything passes. And I believe we need to have overseers of how it's going to be regulated in the state of Texas. And when we do become a legal status, then we can progress from there and evolve into a whole new world of cannabis therapy, just waiting to be tapped into. And once things get legal, then we're more than willing to help and maybe take that next step of maybe being able to provide. But As far as PACT as it is right now, we are not a provider or a producer or a distributor. We are strictly a legislative patient empowerment and support group. I tend to believe that a patient has a right to be down or upset about their condition, but I tend to believe that we shouldn't sit and wallow in it, that we should accept it, see it for what it is, and make the changes necessary to make our lives better.
Speaking of legislative issues, I know that you show up at all of the legislative sessions here at the Texas Capitol. Could you tell us what your presence and others like you, what kind of impact that provides?
Well, one question I have been asked by many different chapters is what do we look for in trying to find a patient rep? Are we on? Yeah. What do we look for in trying to find a patient rep? And I believe, for one, my condition is very obvious. It's very visual. I am in a wheelchair, and I'm pretty thin. You know, I've thinned out in my body. And so it's pretty clear that I'm suffering from something. You know, though it doesn't say exactly what it is, but it's very obvious. And regardless of the person in the seat, the wheelchair itself is a powerful symbol of disability. It signifies an entire group of people who have had to live with suffering. And because of that, I believe this obvious visual presence makes a huge impact, especially when we're talking about the state capitol and working with legislators. I got up to 3 hearings behind me now, and got to have learned a lot between 2011 and 2013, the last 2 sessions. And in that, I've realized how I may have even embarrassed some state representatives or made them halt a little bit, because in reality, they never expected a real patient to be coming up to them with a real issue. And so, yeah, I've seen a lot of shock and a lot of surprises in the fact that, you know, the Capitol doesn't accommodate people like me, people in wheelchairs, in the fact of there's so much furniture in every representative office. It's hard to get around, you know. But why? Because they're not used to seeing people in wheelchairs coming out. And so it does make a visual impact. And I believe with one of the experiences of a public hearing that I've gone through myself was, you know, I tell people, man, when that hearing starts at 9 o'clock and our bill isn't for another few hours, be there at 9 o'clock. Let them see you there. Let them know that you are letting them see you there. And it had an impact. You know, there I was in the front row in the chair, all long sleeve, button-up shirt, tie, you know, my little cannabis pendant, you know, and looking sharp and being the diplomatic presence I needed to be in dress. And coming from a wheelchair, and the thing is, I know they saw me sitting there for hours. And quietly, it worked to the back of their conscious minds. And that's where a visual impact can have without even saying a word. It works to the conscious mind in a way that no word can. And so it made a tremendous impact. And especially if the patient in that position is an empowered patient, then it's definitely taken to a whole nother level.
So you're pretty much just giving them an entire new view on things. Let's say someone wanted to come to one of these PACT meetings. When is your next one, and how would they go about getting there?
Basically, we are in Austin, Texas. We would like to eventually provide transportation. That would be nice if we could provide it for all. But we do encourage carpooling. We definitely offer it with the PACT meetings. People, if you're especially in the central Texas, Austin area, we definitely do a lot of carpooling to where we can get our fellow patients there as well. And we have our meetings sporadically from different places like Genuine Joe's to Opal Divines to sometimes because our next meeting is basically going to be a picnic in the park. And this is a family event for us to just get more acquainted and more bonded as patients, because we all have commonalities and things that we share together. And because of that, that's going to be a real asset to when it comes to facing legislators one-on-one. they're going to be stronger, they're going to be confident, and they're going to be empowered. And we're going to be ready.
Well, thank you, Vincent. If someone wanted to contact you, how would they go about doing that?
You can reach me directly at Vincent at texasnormal.org and or the Austin 420 at hotmail.com and Patient Alliance Texas TX at gmail.com.
All right. Well, thank you, Vincent. We appreciate you being on the show.
Thank you for having me.